Welcome to the Back to Health podcast, where we share inspirational stories of hope to help you reclaim your health. If you're suffering from a chronic condition and have been given little to no hope, if you've been told that there's nothing wrong with you, but you know there definitely is something wrong, or if you're just trying to be preventative and want to know how to reclaim your health, then this podcast is for you. I can't wait to share today's episode. Hello, welcome to the Back to Health podcast. I'm your host, Rashani Mahendran, and today we're talking all about chronic pain and the mind-body connection. Now, my guest today is Chana Studley, and she has recovered from severe PTSD and injuries after 3 separate violent attacks in the 1980s by exploring the nature of thought. She trained as a counsellor with Manchester Women in Crisis Centre and has been working with people in all areas of mental health for 30 years. Chana is a certified life coach and 3 principles practitioner. She is also a proud member of the United Hatzala Psychotrauma and Crisis Unit and a World Health Organization psychological first responder. In 2019, Chana conducted 5 successful case studies into pain relief, and her research was presented at the 3P UK conference in London. She has now turned this into a new program and is helping people all over the world with chronic pain and other physical illnesses to heal by understanding the mind-body connection. Chana also had a very successful career in Hollywood, including an Academy Award. So it gives me great pleasure to welcome her to the episode today. Welcome, Chana. It's such a pleasure to have you on the show today.
Hi, nice to meet you.
And when I read your story, when we first sort of connected, there were so many things that I think, no matter whether you have one sort of as deep as yours, or whether just the last year has been surface level sort of things that you've started to have to deal with mentally and emotionally, I think there's so many nuggets from your story that can resonate with everybody. And so I'm really looking forward to sharing this with our listeners today. And I think I'll just hand it over to you to sort of talk us through your story, like from the beginning, and how you got into mind body connection and healing.
Sure, thank you so much. So really what happened for me is I had some really violent experiences in my early 20s. I was actually mugged 3 times, which is bad enough being mugged 1 time, but 3 times it really did mess me up. I had quite a lot of serious injuries. My skull was fractured. I know you can't see it, but I can put my finger right on a lump right here. My neck was fractured in 2 places. C2 and C3 were cracked through. And I had 3 herniated discs from where I was slammed on the ground by some guys that mugged me. And 2 of them happened in Manchester in England, and 1 of them happened in London. And so after the 3rd one in London, I got pretty messed up in my thinking, because it was like I was terrified to leave the house, and I had evidence, I had police reports and x-rays to prove that the world is a very dangerous place. And this was in the early 1980s. So PTSD had only just gone into the DSM at that time. So in Manchester and then in London, nobody really knew what that was. And I basically got told, have a cup of tea and go home. That was really the treatment I got. I wasn't even sent to the hospital. I saw my family doctor when I had the neck thing, and he just moved my head around and said, "Oh, you're fine." So I didn't
Wow.
get an x-ray. It wasn't until 2 years later I found out that they'd actually broken the bones. I mean, thank God the spinal cord was only maybe bruised, but not obviously seriously damaged. And so I'd been walking around for 2 years with a broken neck and didn't know. So anybody who's listening, I strongly urge, get checked by a medical professional. That's really important to rule out anything organic or structural. And then following that, I kind of had chronic pain for about 25 years. And whenever I would tell a doctor or a chiropractor or osteopath, anybody who was trying to help me, a medical history, and I told them about the injuries that I'd had, they go, "Oh, well, of course, that's why you're in pain." And I'm not a doctor, so I believed them. And they would say things like, "Well, you've got 1 leg longer than the other, and that makes your pelvis unstable, and so that's why you have such bad lower back pain." Or, I would wake up and my arm would be numb. And they'd say, "Well, that's because the nerve for your arm comes, from that part of your neck where your neck was broken." And so I actually was paralyzed several times. I was rushed to the emergency room several times. Once I recovered from the PTSD part of my story, I actually got really well, thank God to some ladies who really helped me, coached me, got me through all that dark time. And I started working first in the theater, and then in TV, and then in movies. So I actually had this really successful Hollywood career, and I was in Australia working on a movie. And I woke up in the middle of the night and my chin was stuck down on my collarbone like that. I was like screaming in pain. I couldn't move like the whole top of my body. And luckily there was a chiropractor in the village next to where we were filming. We were out in the middle of nowhere. And he said to me, he said, you're going to need treatment for the rest of your life, or else you're going to keep getting these like episodes of being paralyzed, which was terrifying.
Mm.
Forgetting that I'd walked into his office, I'm now thinking wheelchair, surgery, paralyzed. I mean, the fear that came up in me in that moment was horrendous. And so I went to the chiropractor every month for 25 years. And I tried other things. I did the Pilates, the yoga, mindfulness, all the, got into all kinds of personal transformation stuff. I'd actually trained as a counselor when I was in college in Manchester University. And so I was always interested in personal transformation, but I never linked it with the pain because I thought the pain was coming from injuries. So therefore, I just had to cope with it. I just had to live with it. And it wasn't until about 6 years ago when I came across a new understanding of the mind, a new paradigm in psychology. And I got so excited about it. I actually live in Israel now, in Jerusalem. So I had to go to London to train. And I was flying backwards and forwards quite a few times for 6 months. And I thought, I didn't have time for the chiropractor. I was trying to save money and all that kind of stuff. And at the end of the 6-month course, I noticed all my pain had gone away. I hadn't had any episodes. I hadn't even thought of needing treatment. And I thought about it, and the pain had actually been gone since I actually came across these new ideas. And I got so excited about this that I thought maybe I should do some research and see if I could recreate that in other people. So that's kind of how I came to be, having these kind of conversations where reaching out and showing other people that no matter what's happened to you, there is a way to feel better.
That is just, I mean, there's so many parts to that story, but that is just so amazing that, without even realizing, you can come across something that can help you. And I think this is many people's story, especially when you live with chronic pain. You almost resign yourself to the fact that I'm just going to have to cope with this. I'm just going to have to live with whatever I've been given. And yes, maybe there's this modality that can help me maintain my condition. There's this thing that can help me just maybe reduce the pain a little bit. And then it's sort of almost when you like give it over or give up,
Yeah.
that is when something finds you and is like, no, there is something that can help you. There is
Yeah.
something that can be done. And I also want to just touch on the point you mentioned about, you had real, not just real, but multiple real instances of things that prove to you that the world is a really dangerous place. It's really unsafe. And I have to say, from my own experience, when I was a baby, my mum was mugged once, and then my grandma was mugged 2 or 3 times, like all within the space of 2 or 3 years, because the area they were living in wasn't very safe. And I grew up hearing those stories about be careful when you're on the road and always look behind you and listen out for things and don't cover you, don't wear headphones and all
Yeah.
these things as I was growing up. And even just as anecdotal things sort of built a fear in me of this world is not a safe place and you've got to be very careful. You always need to be looking over your shoulder. You need to like check the both sides of the street to make sure no one's following you, all that kind of stuff.
Mhm.
And so for people who are probably feeling that right now, like, we're all living in a sense of the
Yeah.
world's not a very safe place right now, like what would be some of your tips in terms of how we can try and reframe that for ourselves to allow us to almost like disassociate yourself with that feeling so that you can then start working on moving forward, if you like?
Yeah, yeah, it is. It was a huge concern for me for a very long time, and one of the symptoms of PTSD is being hypervigilant. So whether you've been through it yourself or, like you said, you've grown up with that warning, that fear, being hypervigilant about your circumstances is often one of the symptoms that people experience in that situation. And I definitely had it. For me, it was the sound of footsteps behind me because the second of the three muggings, the second one in Manchester, three men came out of the dark. It was 6 o'clock in the evening. I was walking near my home because it was February. It was already dark. And the sound of footsteps behind me for years afterwards terrified me. And then it started to fade, and then it kind of went away. And then when I came across these new ideas that I want to tell you about, what I learned was that we're always feeling our thinking, that we live in a thought created world 100% of the time. So when I was having a reaction to hearing footsteps, it wasn't the footsteps that were creating my fear. It was my thoughts about them, my imagination of what did happen, what could happen, what might happen. So what I'm sharing with people is that we're living in a thought created world all the time. So safety is actually a state of mind, because two people could be in exactly the same situation and have a very different experience of it. For example, I have a girlfriend, and we were out a little while ago. We were walking back. It was about 11 o'clock at night through our own neighborhood. And we're chatting away. We'd been out to an event or something. I can't remember what it was now. And we're just chatting as we're walking back, and like about 10 minutes from where we live. And she said to me, she said, "You're not scared, are you?" And I was like, "Scared of what? What?" And she said, "I mean, after what you went through, you're not scared to walk in the dark?" And I'm like, "No." And I realized as we were talking, she was having thoughts, I'm guessing, because that was on her mind. What if someone jumps out of the dark? What if, like we're in danger? It wasn't even crossing my mind. So here we were, two similar women in exactly the same situation, having a completely different experience of it.
Yeah.
So you can apply that to any situation. Just think about the last time you watched a movie with someone. One person's like really enjoying it, having a great time. The other person's like, "Oh, this is so boring," So therefore, it can't be the movie that's producing our experience. It's our thoughts about it. And the same is true of danger. The same is true of pain. There's lots of research to prove that if you're in a low mood, like a low state of mind, you're going to feel pain, sense danger, see imperfection, notice all the negative stuff a lot more than someone who's in a better mood, a higher level of consciousness, in exactly the same situation. So feeling scared is really, I've learned that it's not something to be frightened of. It's almost like a little tap on my shoulder. It's just letting me know that my thinking's heading in the wrong direction.
Mm.
Because if I start walking down the street thinking, what if, what's that noise like? What's coming from? I'm going to get more scared. I'm going to get more jumpy. And then I'm living in the experience of my thinking, not my actual circumstances. So when people said to me, "Oh, just come out," and I'm like, "Oh, no, I can't go out. I can't go out." I knew the world was a dangerous place because I had evidence and my thinking was telling me so. But the world didn't change so much as my thinking and my perception of it changed. And that's what I then am now living in, is that, yes, it's probably a good idea to, be safe, don't go out late at night in the dark. I lived in Los Angeles for many, many years, and I lived on the beach. I was very lucky to live on the beach. But the beach where I lived on Venice Beach, it's very wide there. So I would never have gone down to the ocean at night on my own in the dark, because if something happened, God forbid, like nobody back at the boardwalk could have heard me. But I would have gone with a friend. I wasn't frightened. I was just being sensible,
Mm.
So it's like finding that balance between, common sense and being informed, and not living in a world of fear, or being so stressed out that my thinking has taken over. And that's what's creating the fearful experience.
Yes, I think that does make so much sense to me. But there's part of me, and maybe some of the listeners may be feeling the same, is that yes, I can sort of try and turn off those thoughts, or like reframe my thoughts in that situation to not be scared, thinking if I give in to that, I'm just going to be sort of going into a spiral of more and more negativity. But what do we do when we know there is potentially a risk? Like, there is a risk that something could happen. Like, yes, it could be rare. It could be like, how do you overcome the fact that in that situation, 11 p.m. at night in the dark, there is potentially a risk that someone could jump out, like that could happen? How do we stop ourselves? I guess what I'm struggling with is like, how do we stop ourselves even like going down that road of thinking that there is a possibility though? So how do I stop myself from worrying about the possibility, I guess, is my question.
Right. So that's what I benefited so much from in this new understanding, is that what I know now is thought. Thought is, because we live in this thought created world, and thought is an energy. It's a creative energy, and it's constantly flowing through our minds. Because when a thought comes in the past, I used to think like I had to analyze it, judge it, like you said, reframe it, put a different spin on it, maybe a soundtrack, like there's lots of different techniques and methods out there. And I found that most of those techniques and methods are really good for the person who invented them. But I don't know about you, because when I'm in a good mood, I don't need those techniques and methods.
Yeah, yeah,
And when I'm in a low mood or scared, like you're describing, I forget that. I've got time to get a piece of paper and journal my fears out or something. It's like it's happening right now.
yeah.
So what I found is understanding that thought is always moving, and just because a thought came into my mind doesn't mean it's real. In fact, it's not real. It's just energy. It's just a commentary passing through my mind. And thinking is just one of the things I can do with this gift of thought. I can make myself anxious with it. I can be creative with it. I can, sometimes it shows up as words or like a kind of a voice, like a commentary. Sometimes thought shows up as images or music or numbers, depending what your interests are. So if I'm walking somewhere and there could be like a noise or something, it's like I just know it's it sounds trite to say it's just your thinking, but it's never not your thinking. Because remember, we just established that we're only ever experiencing our thoughts about it. And if you know thoughts move, and kind of like my favorite analogy is clouds. Thoughts are like clouds. They're constantly moving. You could say, well, should I let them go by? Well, you can let them go by, but they're going to move anyway. Right? That's just the nature of them. You can't actually, now they can repeat themselves if we jump on them and start analyzing and worrying about it. It could be like what I'd call a thought storm. But it's the thought storm that's now sending my blood pressure up and getting my heart to beat fast, and that's activates the fight or flight response, and then that's often what then turns into physical, like chronic pain, chronic issues. Like I had not just the back pain, I had stomach problems, severe allergies, asthma, eczema. Like most people who suffer from chronic pain often have those other symptoms as well, because if you're living in a world, a scary thought world, like a thought storm all the time, scared of danger, scared of something like what if, then that is going to start producing, a dysregulation in your system. And that's what develops into a chronic situation. So for me, seeing that I didn't have to even ignore my thoughts, because ignoring actually takes energy. Like right now I'm looking at you and I can see you've got blue headphones on. I'm going to try and ignore those blue headphones, right? Now it takes effort. I'll have to maybe block them out with my hands, but see, so I don't actually have to ignore my thinking, because if I step back and observe it, even the scary thoughts, they will just go by. And the moment I see, oh my gosh, I just got caught up in some thinking, it will naturally start to settle down and you'll feel safe again.
Yes. And so how do people go about transferring their thinking to this point? Because I guess it's not one of those things that you can't just say overnight, like, right, I'm going to stop, like, obsessing about this thing or allowing myself to get scared about this thing. Like, how do people transition to this way of looking at the world and of sort of being, if you like?
Right. So I would tell you that it can happen like that, because if we're only ever experiencing our thinking, your next thought could be a good one. We are like the man who put these ideas together. His name's Sydney Banks. If the listeners want to look this up, and I'd be happy to, tell you more about him. He was around he was a Scottish man in around the 1970s, and he had this kind of, enlightenment experience where he suddenly saw, someone said to him, because he was talking about being insecure, and someone said to him, "You're not insecure. You just think you are." And he just saw through the illusion of thought. Like it's not like I think I'm unsafe, or I think I'm, and we tell ourselves stories all the time. So a story could be that I'm not safe, or a story is that I'm never going to get well, or this pain's going to last forever. The stories that we're creating them. And because thought is always moving, the moment I see through the illusion of that story that I've created with my scary thinking, it can vanish. I've seen it with so many people and with myself, because we can all get caught up. We're all human. Life stuff happens, and the moment I get caught up in my thinking, the moment I catch that, and the way you catch it is, if you don't, sometimes you can hear like how ridiculous a thought can be, but sometimes you can feel it. Like low mood thinking has a certain feel to it. It feels heavy. It feels tight. It feels urgent. I've noticed with a lot of my clients, like when they're in a low mood, there's like black and white thinking, very rigid, very like hopeless, self-pity starts sneaking in, all that kind of grumpy kind of thinking. And I've added Googling on there as well, because people start Googling when they're in a low place, it's understandable, desperate to find a solution. And so when you're in that place, like I said, it feels heavy and tight and urgent. Sometimes even just feeling that to me is like a little tap on the shoulder. Careful, Hannah, you're looking in the wrong direction. You're heading down, or you're about to get on a bus that's going to take you in the wrong direction. and you're going to end up somewhere you don't want to be. And it's like a click. The moment you see that and you can kind of step back and observe it, which we're all doing all the time, because we all have what they say, something like 80,000 thoughts a day.
Yeah.
So there's already a lot of thoughts going through your head that you're not reacting to, that you're not jumping on. So it's not a skill you have to learn because you're already doing it. It's just like seeing it to be true and understanding that at any moment, everybody has good mental health. Everybody has well-being. It's innate. It's like in you. And it only just got covered up by that stinky thinking that we got, delusioned by. So the moment you see through the illusion, poof, it just goes away, and you can actually be back to good mental health and good well-being instantly. Now, you might pop in and out of it, but what I found is the more you rely on the fact that it's a reliable system, that you have innate well-being, and it's just being caught up in some thought, that it will pass. It always passes. Think about every bad mood you've ever had, it passes. Every broken heart you've ever had, it passes. Every flare-up of pain, it passes. So if you can, even when it's really bad, you can hang on to your seat and just know it's going to pass. I just got caught up in some thinking. Even that trust is going to lift you up, because we're all resilient. That's what resilience is. Resilience naturally bounces you back up when you see that it was just my thinking that was taking me down.
That's so interesting. And how do we then apply that so coming back to your sort of story, about 6 months, you'd had no pain, nothing had sort of bothered you, you were just wondering, what's going on here? How do we apply this to pain, something we feel physically within our bodies?
Right. Yeah, that fascinated me because, like I said, I'm not a doctor. I didn't know what had happened, and I started researching. And one of my friends asked me if I'd heard of Dr. Sarno, and so some of your listeners may have heard of. Dr. Sarno was one of the pioneers of mind-body medicine, and he did a lot of work. He was a doctor in New York, and I love his medical explanations because it saves me from going to medical school. But I kind of found that the solutions that most people are in that kind of pain management world are offering were very much about going back into the past and digging up, things, and which didn't make sense to me, because if a dysregulation of my nervous system, which has been caused by stressful thinking, prolonged stressful thinking, has gotten me into this mess, how is digging around in a painful past going to fix that? So one of the things I loved about Dr. Sarno was that he said that a lot of people got well just from reading his books. And I have no problem with that, because clearly they've had a shift in their thinking. Because if you're in Johannesburg or London or, Argentina, and you never met Dr. Sarno and you got well just from reading his book, you've clearly had an insight. You've had an insight into the information that he was offering. Yeah. And so that's where I took my work, kind of takes off from there, in that any kind of intellectual solution, trying to fix and change our thinking, trying to fix our circumstances, is actually my mother used to call it rearranging the furniture on the Titanic. Meaning, it's like the boat's going down and you're redecorating. It's like don't waste your time. What we want to do, we want an insight, a sight from within, something fresh and new that is going to connect you back to that well-being, that guide inside, that innate resilience. And that's where healing happens. Because even when people say to me, yeah, but I love my journaling, or I love my meditation, my mindfulness, whatever. And by the way, if something works for you, that's fantastic. I'm not in the business of twisting anybody's arms. We don't want anybody to be suffering. But I always ask people, how is it working? If you're curious about how it's working, and the kind of analogy I came up with that was, I had a girlfriend who, she also has a lot of physical issues, and she goes to acupuncture, and she loves her acupuncturist. And so I asked her one time, what is it about the acupuncture that you like? And she said, just I'm on the way there and I start to relax. She said, because she's so lovely, and there's the kind of soft music, and there's the smell of the essential oils, and then there's, I lie down and I just, I can forget about all my problems. And she does her needlework, her work with the needles. And so I talk with her a little bit. She gives me some suggestions, and then I feel so much better. I feel calm. And I thought, ooh, that's what it is. You see, look at any therapy, technique, method, whatever you want to call it. And what they're really doing is slowing people down. slowing down your thinking, because anxiety really is speeded up thinking. So if the therapy or technique that you enjoy has slowed down your thinking, that is what is helping you, because it's getting you back in connection with your innate well-being that was always there. But the innocent mistake we often make is we associate the practitioner or the practice or that room or the doing as that's what's creating the calm, which is why people often go back again and again. So the analogy I came up with is like a petrol station. It's like, for her, going to the acupuncturist was like filling up at the petrol station. You know, in your car, you have there's usually a dial. And so what happens is she would then go home and have to deal with the mortgage and kids and careers and neighbors and family members. And so the calm is starting to, run out, like the petrol runs out in your car. And so she would have to run back to the acupuncturist, innocently misunderstanding that she had it in her all the time, but she thinks it's in the acupuncturist's office, or we think it's in the act of journaling, or we think it's at the beach, or walking in the mountains, or, like some people get their bright ideas in the shower, or walking the dog. Those places don't have any magical, calm vibes. It's that you slowed down in those moments and you reconnected with what's already in you. So what I'm showing people is kind of like a shortcut. Because if you know it's already in you, then, and you can see that thought is moving, and when your thoughts slow down, there's kind of space in between the thoughts, then that's why I tell people I actually haven't done anything. My 25 years of chronic pain went away without me actually doing anything. I haven't journaled. I haven't meditated. Believe me, I did a lot of that stuff in the past. I haven't, I don't even do yoga or Pilates or anything like that. I do walk. I love exercising. I do it because I enjoy it, because it's good to move a body, not because I believe I need fixing anymore. There's actually nothing wrong. And like I said, as long as you've been checked by a doctor and you've been told that there's either nothing structurally wrong, or what's structurally wrong can't be causing the level of pain you're experiencing, then clearly something else is causing it. And in my experience, when thinking slows down, when you see that you actually are not broken, you don't need fixing, you have well-being, people go, oh, start having insights, like I did with, my injuries had healed 25 years ago. Why was I still having pain? So it's just, it really comes from insight, a sight from within, and you reconnect to that wellness. And that's when people start healing.
And that is so powerful, to be able to be in a place where you can say, I don't need any fixing. Like,
Yes.
most of us think there's something in us that needs fixing. I have this limiting belief. I have this strange thought. I have this spiraling moment, or something that takes me down a road of anxiety. And there's something wrong with me, right? This is what we're told as well when you go to see practitioners. Like, oh, you've got this issue, or we label it. And sometimes I think those labels can be damaging as well, because like, you have anxiety, you have chronic pain, you have fibromyalgia, whatever that means, right? And all these things just mean you have some constant like pattern of being that is leading to these things, and it's not that you need fixing. I think it's become very clear to me since you've been speaking that it's your thoughts that not even need fixing, but just need slowing
Yeah.
down. And that is so powerful, the fact that you don't actually have to go get your spanners and screwdrivers and the whole toolbox you're told you need to have. Like, if
Yeah.
that tool's not working, try another tool. If that tool's not working, like, try a chisel this time. And if that's not working, try a hammer. And it's like, people go through life like looking for all these tools and like, oh, that worked for a little bit, but it's not really working anymore, and now I need something else. And sometimes I found you can get addicted to the personal development sort of like space, like going from one thing to one thing, because suddenly that new tool makes you feel a certain way, and tapping into that different feeling can like temporarily make you feel good, and you're like, oh, that's doing something for me. But again, like you say, what it's doing is allowing that person to slow down, because it's new, it's exciting, it's a different energy than what they're used to. And then after a little while, when you get bored of that thing, or you're not really tapping into it like you used to, because it's lost the kind of excitement that came when you first discovered journaling, or the first time you
Right.
discovered Pilates, or the first time you discovered yoga, it's that thing of, oh, what's the next thing I need to go look for? Because we're always looking outside of ourselves. And this is one of the things that I know I am very guilty of. It's like, what's the next thing, and what's outside of me, and what's the next book? I'm a big person for, I'll buy the next book and that book's going to enlighten me, and I'll buy another book and that's going to enlighten me some more. And you sort of find yourself in this spiral, when actually I think from what you're saying, that's just really sort of opened it up for me that you have it already. You're searching for something that you already have, and it's just about moving the things that are blocking it maybe out of the way. Would that be the right way to look at that?
Yeah, I'm loving your insights. This is great. Yeah, because if the wellness is already there, then all that busy doing is covering it up.
Mm.
And I've noticed with, like, working with chronic pain people for quite a few years now, that there's a certain personality type, and it's like all that busy doing that you just described is almost like symptomatic of the personality type that gets chronic pain. Because what I started noticing is chronic pain people are usually perfectionists, doers. Dr. Sarno called them goodists as well. If nobody else is going to do it, I better do it. That kind of like, if we have to do the right thing, and there's a sense of justice, and I'm being responsible by Googling everything and trying everything. It'd be irresponsible not to.
Yeah.
So there's a kind of mindset that's keeping the brain in survival mode. Because before I was, I'd experienced this relief with my own chronic pain. I was a trauma counselor because of all the things that had happened to me before. So I learned a lot about the fight or flight response. And the way I kind of see it all coming together is people who have a kind of perfectionist mindset are, I'll talk about myself, very judgmental, and not judgmental in like, it was very subtle because I'm English and we're very polite about it, but my mind is constantly monitoring my circumstances. Remember, we were talking about hypervigilance, in terms of trauma. But then I noticed I was actually very vigilant about, look how that car's parked. Like, if it's over the white line, like the poor person parking next to them, how are they going to open their door? Like, it's nothing to do with me, but I'm constantly monitoring. I'm noticing, if that color was a bit darker blue, then it would be easier for people to find that signpost. Or, it's like, just constant. And if your mind is constantly noticing everything that's wrong, then your brain interprets that as danger. And the fight or flight response was designed to only be active for about 30 minutes. Because if you are actually in a, God forbid, a car accident, a burning house, being chased by a tiger, whatever the dangerous situation is, in 30 minutes, you should be able to either find the exit, escape the tiger, get out of the burning house or the car, and you're safe. And then it takes about 72 hours for all those stress chemicals, adrenaline, cortisol, epinephrine, cortisol, they're all going to be like dissolved out of the body in 72 hours. And in 72 hours, you're ready to face another emergency, hopefully not. But if you're in stress for more than 30 minutes, which most people are who have any kind of anxiety, and it's for 2 hours, 4 hours, 8, 16 hours a day, day after day. And it doesn't have to be like high anxiety, panic attack stress. It can be, like I was saying, just noticing everything that's wrong. They didn't call me back. They don't pay me enough. It's like, why is this happening to me? Why is my pain back? I've tried so hard, and now I spent all that money on a course, and I'm still, that constant agitation and frustration is like a drip, drip, drip on this, keeping the fight or flight response kind of just bubbling under the surface. And that's what dysregulates a lot of the systems in the body. The adrenals get tired. There's so much adrenaline in the body that we get heart problems. People get palpitations. There's actually a high increase of diabetes right now because there's so much glucose in the system. People are getting migraines. People are getting, IBS is a big problem. People are getting gut. And what I learned, it's because if you're actually in the fight or flight response, your brain thinks it's trying to help you survive. And if you're kind of running for your life, at least that's what your brain thinks is happening, then it will shut down things that are a luxury, like digesting lunch, which is why a lot of people have stomach problems who have been in depression and anxiety for a long time, because there are not enough, the right enzymes are getting sent to the gut to digest your food. It's why people get fertility problems, because making babies is a luxury if you're running for your life. So that's why fertility is often, an issue. But it also shuts down, and thank God these are all temporary, so I don't want to scare anybody, but it can shut down things like creativity, because if you're in survival mode, then your brain isn't going to give needed glucose energy to, redecorating when you need to be, finding the exit, and forward planning too, which is why, if you talk to someone who's been anxious or depressed for a long time, say, well, let's just take a painting class. They'll go, huh? Because it's like, it's just not possible when your mind is focused on surviving.
Hmm.
Now, usually when I talk like this, people will say, but I'm not that stressed. I'm not, scared I'm going to die. You say, well, like it's sometimes very, very subtle. And like I was saying just now about how we live in this thought created world, if it's become normal for you to have that kind of bit of complainy, judgy kind of thinking, and um, and always thinking like glass half empty kind of thinking, like, why does this always go wrong? And they're listening to what I'm saying and they're going, yeah, but you don't know my situation, or but what if, all that kind of thinking is going to be sending a message to the brain that there's something wrong.
Hmm.
And that's keeping us in a constant low level of anxiety, which is a low level of fight or flight, which is producing things like eczema and asthma and allergies and all kinds of stuff. So once you recognize that and you see that it's just innocently got caught up in some stinky thinking, and you like that next time that what if comes, or that yeah but, like, not listening to that, it's just a thought, it's just a passing cloud, you can actually get free of it without actually having to, like you said, go back into all these techniques and get your toolkit out and try and fix it. Yeah.
Yeah, because it does feel like it's that sort of a situation. Like something's wrong with my thinking, and so I need to like fix it. And fix is like the word that is used quite commonly. I mean, they
Yeah.
might not use the word fix, but that's sort of what they're alluding to. That there's something that needs tightening. There's something that needs like plastering back together. There's something
Mhm.
that needs, some sort of patchwork. When actually it's already all whole. It just may have things that are blocking the view, and so you need to move those things out the way. That has been quite an epiphany for me actually, from this conversation. But I guess another side of it is like sort of living in circumstances that are beyond your control. Like, of course, the thoughts are in your control, but things outside of you that are happening that you can see unfolding. And, if we just talk about the pandemic in the last year and all the things that have been unfolding, and things are concerning because you come across some data and it's like, oh, this doesn't totally add up, or, oh, I'm reading this thing over here and that concerns me a little bit. I guess, like, how can we keep ourselves sort of, we want to be informed, we do understand the concerns and we have concerns, but not spiral that into a situation where it's going into the stinky thinking territory. Like,
Right.
how do you like partition that, I guess, is my question.
um yeah, it's a tricky one if I think it's tricky. Right, because
Mm,
remember, it comes back to thinking. And I think I'm a big fan of common sense. I think common sense has kind of gone out of fashion recently. It's because if you think of moods going up and down, like we were saying just now, if I'm in a low mood, I'm going to be Googling, I'm going to find that one person in some weird place, who says, yes, that's it, you're going to be in pain for the rest of your life, you're never going to get well. And we'll pick up on that one thing.
yep.
Right. So um, what if you know that when you're in a low mood and you've just spent like 10 minutes Googling things and you've started filling your brain up with like dodgy information, that in that moment you're like, oh my gosh, what am I doing? I am torturing myself
Hmm.
with this thinking. And you pop up to a better mood, like you walk away from it and you start feeling a little bit better. Common sense hangs out up here. And I recently did a course with a Dr. Howard Schubiner. I don't know if your listeners might have heard of him. And it was a course for practitioners to help their clients decide whether what they're experiencing is a structural thing, like an organic situation, like a, God forbid, a tumor, fracture, something like that, or whether it is a mind-body, stress-induced situation. And he had this, he called it the mom technique. He's American, so he'd say mom, like we'd say mum, right? Put it the mum method, meaning if something is wrong, what would your mum say? And obviously, we're generalizing about mothers here because we don't all have the best relationship with moms. But let's say an idealized mom, what would she say? If she says it needs a plaster, we put a plaster on it. If she says go to the emergency room, we go to the emergency room. And if she says, honey, it's okay, just rest or lie down. So it's kind of like a common sense kind of rule. And some people call it I think the three B's, like bleeding, bruised, and bumped. Like then get it checked out.
Hmm.
Otherwise, if it was just coming from overthinking something, then that overthinking, when it slows down, is going to pass. And the best way you can tell whether you got caught up in thought or not is how it feels. Like I was saying earlier, if it feels heavy, it feels urgent, stop, because
Hmm.
that's taking you in the wrong direction.
Hmm.
If it's true and it's valuable and it's going to help you, there will be energy there. There'll be a lightness to it. Because like real fear actually has energy, because real fear is actually producing physical energy to help you run, to get away, to survive.
Yeah.
Anxiety has a heavy feeling, and it's actually draining. People who have like things like fibromyalgia and chronic fatigue syndrome, like I have a colleague, and he recovered from very severe chronic fatigue syndrome. He was in the hospital for months, and he said the turnaround for him when he started getting well was when the doctor said to him, "Do you know how much energy it takes to be tired all the time?"
Mm.
And like a light bulb went off in his head, and he started realizing, "Oh my gosh, I've been doing this to myself." And then some people can hear that and go, "Oh gosh, I've been doing this to myself," and then use that to beat themselves up with. I'm like,
Yeah.
no, don't go there. That's just another thought. Like my light bulb moment was when I read Dr. Sano said that all injuries heal. So then I thought, then okay, then if I'm still suffering pain now from injuries that healed 25 years ago, then that's new information. And that was a light bulb moment for me. So I think when people have shifts and get well, it's because they've had an insight. And that insight has energy and it has lightness to it. It's like, follow that feeling.
Mm-hmm.
If it's heavy and urgent and tight and constricted, I stay away from that now, no matter what the content of it's saying. Listen to me, or this makes sense, or so and so says this, or I'm like, if it's true, it'll be true in 5 minutes, it'll be true tomorrow.
Mm-hmm.
So just like, even just how it feels is a good clue of which direction it should be moving in.
That is very powerful, because I think it is so easy sometimes. And in this last week, actually, I've struggled with this a little bit, because you read so much and you're consuming so much, and there's stuff coming from here and people that you really trust and people that you really respect, and groups that you're part of, and you're like, all these things are happening, and it's so easy to then just like feed into that, and it feels like you can go down a bit of a spiral. Like, as much as I like to say, just take the facts, that you need, and then sort of don't be emotive, don't be emotional about it, because these are going to be the facts. Like you say, these are the facts today, and they'll still be the facts tomorrow if that's true, and it will still be the facts in a week or a year if that's the case. But don't let it affect your energy. And so I have really been trying to find a way where I can separate my energy from being able to consume this information, but just look at it as information and not get too attached to the fact that, oh no, but this could mean this, and this could mean that, and this could mean this other thing, and sort of spiraling into that, the sense of, like you say, actually it feels very heavy and it feels very urgent, and not allowing yourself to get to the point where it does feel so urgent that you're sort of wondering what you're supposed to, like, what am I supposed to be doing right
Yes.
now? So there is a really sort of fine line and a balance that you have to find. And so for anyone listening who may have been feeling like that recently, I just want just to say that you're not alone. It's a really hard thing to do. I struggle with it myself, and actually I think this conversation has helped me sort of just understand that a little bit more, so that I can work on actually saying, you know what, when it starts to feel heavy, go for a walk or find the thing that helps you just disassociate for a second, while you can just fill your cup back up to be able to like have a bit more of a common sense approach, basically.
Right, because that's your wisdom telling you to take a walk, take a break, move away from it. And wisdom is like that. That's also innate. We all have it. We all have the wisdom to know what the right thing is for us. So any kind of debate is really just speeded up thinking. And that urgency, that was such a light bulb moment for me too, when I have a friend and she calls it jumpy pony feeling. Like,
Mm-hmm.
I've got to do it now. Like, I've got to send that email now. I've got to, sign up for this course now. And so that for me is like a complete red flag. If I feel that jumpy pony urgent thing, I know that is coming from low thinking. And
Mm-hmm.
my wisdom says to me, walk away, take a deep breath, come back to it in a moment. If it's true, it'll still be there, like so. Or maybe there's a better way to rephrase that post or that comment on Facebook or whatever it is,
Yeah.
and just like trusting your own wisdom and resilience, because everybody has it. That and like you said, it just got covered up by some stinky thinking and it's innocent. My teacher, who's his name's Dr. Bill Pattett, and he's a psychiatrist he's just retired now. He's got 50 years of experience, dealing with the psychiatric treatments and these new ideas. He's board certified in somatic medicine and all kinds of amazing things. And he always stresses the word innocent. It's an innocent misunderstanding. We innocently got caught up, right? It can happen to anybody. I can still have a funky moment. But the moment you see that you got caught up, poof, it just, because it was only made of thought in the first place.
Mm-hmm.
There's actually nothing to tackle or fight, because it was just an idea, it was a concept. And remember, it's always moving. So, because a lot of those techniques are kind of like, imagine thoughts are like a train going through a station. So let's say the train left the station. Imagine dragging it back in so we can work out how to make it leave.
Yeah.
Well, it's already left, right? So
Let it go.
you let it go, because a lot of the techniques and methods out there, the reason they're so exhausting and we have to keep at them is because they're kind of messing with the system. If
Hmm.
the system is built to move and flow, and we try and get in there and fix it and change it, then we're actually kind of messing it up. Like that's why traffic is a kind of a good analogy. When traffic is flowing, it's doing its thing. But if I get in the middle of the road and start, directing traffic and organizing, it's going to be dangerous. I'm probably going to be unpopular, and it'll probably mess up the system.
Hmm.
Whereas if I stand on the pavement, at the bus stop, and wait for the bus that I need, wait for the thought that I need, the intuition, the wisdom is going to come along, because that's a reliable system. And being able to just observe all the other thoughts that you don't need and don't need attention, and just letting them go, is such a calmer way to live. And
Yeah.
I think that's why my pain went away. That's why I had chronic allergies, IBS, I had eczema, I had asthma, all kinds of things. Thank God, not all exactly the same time, but they like all those things I had experienced, and they came and went,
Hmm.
and they've all gone. And I think it's because my thinking slowed down. It sent a safe message to my nervous system, and that's where the healing came from.
Thank you so much. I mean, this has been just such an insightful episode for me, and I'm sure for everybody listening as well. Are there any last words or thoughts that you'd like to leave the listeners with before we end the episode?
I think really it's just the knowing that there's nothing wrong with you. You're not like my teacher Bill Pettit. He always says, "Never broken. Nothing lacking. You don't need fixing." And it's one thing if I tell you that, you might go, "Yeah, but." When you know it yourself, when you see it to be true, that's like, wow. It's such good news. And when I did 5 case studies when I started trying to recreate this in other people. I had 5 volunteers who volunteered to do some research work with me. And at the end of the program, they all said to me that it really touched them that I knew they were well, that I knew there was nothing wrong with them. Because when you be going to doctors, like you were saying earlier, you go to doctors and you just become a diagnosis and you become a label. You're that knee pain, you're the shoulder pain, you're the migraine, the gut problem. But I was talking to them like people. They were human beings sitting across from me, and we were having these amazing conversations like we're having now. And just that belief that you're well and you have resilience. Everybody has innate wisdom, innate well-being, and from there can spring all kinds of healing and insights that take us to better places.
I love that so much. And I think that is actually one of my biggest takeaways from today's episode, that you don't need fixing, and you don't need tools, and you don't need a tool
Yes.
belt and a kit, and you don't have to keep adding to them, because that is one of the things you can get so addicted to. Oh, there's another shiny tool over there. Let me go grab that one.
Right.
So that has definitely been also my biggest takeaway from today. Thank you so much again. And we will be linking all of Hannah's details below the episode in the show notes. So be sure to check out the work that she does. She's also written some books, so you can check those out as well, which we'll be linking. And if you'd like to dive deeper into this topic, as I think many of us need to do, because it's so easy to get caught up in those spirals, especially in the climate that we are in at the moment, then do take stock to just slow down, whatever that modality might be for you, whatever helps you do that. If there's one action you can take from today's episode, I would say that would be it. Just take some time to slow down. Thank you so much again for listening. And if you'd like to catch more episodes of the Back to Health podcast, you can catch the links in the show notes too. Thanks again, Hannah, for joining us today.
Thank you. My pleasure.
Thank you so much for listening to today's episode. If you would like any of the links or the show notes, you can follow them in the description below. And for more episodes of the Back to Health podcast, please be sure to follow us on YouTube, or you can follow us on Spreaker, where we host our podcast. Thanks again, and I look forward to joining you for another episode of the Back to Health podcast. Until then, stay healthy, stay happy, and stay informed.